the testing, and then of course your approach to like taking in my skepticism and not being afraid of it, right? And
I was like, bring it.
yeah, exactly. That kind of stuff really helped me to ease in. So now I'm feeling, more trusting, and I would say that that's been a beautiful kind of separate piece of this outside of my health, has just been entering into a trusting relationship with the medical professional.
So Jen, this is 3 months later since you started the program, just 3 months. And you've been dealing with these symptoms for what, at least 10, 20 years?
Yeah, about 10 to 12 years.
12 years. 12 years, these symptoms. 3 months, you've just finished our program, okay? 3 months ago, you started our program. Where are those symptoms at right now? And mind you guys, I tell people that our program is a launch pad to a year of autoimmune turnaround. So these are early results. So where are we just 3 months out?
3 months out, I'm having incredible GI improvement.
Partners, yes, you've changed my life.
Yes, very huge deal. I do still, from like kind of day to day, we'll deal with some acid reflux, but I was dealing with pretty intense acid reflux 24/7. And I would say now it happens every other week, once every other week, I'll have like kind of a mild bout of it. And I'm like, oh, well, I could deal with this.
You continue to progress in it too. I bet you like even 2 weeks ago and now there's a big difference in how the heartburn is happening as well.
Well, I'm also in the kill. So I know that we've talked about maybe it being a symptom of that.
Come on. It's related to infection, of course.
Yeah, exactly. So I still have some lower GI stuff that's going on, because in the testing we found that I have, kind of severe pancreatic insufficiency or the
digestion.
Enzymes. Yes.
Huge.
Yes.
Who knew?
Huge.
I didn't even mention digestion in all your 12 years of dealing with these problems.
No, and I remember going to doctors saying, I think I have candida. And then sometimes I'd go in and say, I think I have a digestive problem. Should I be on like a digestive enzyme? And every time they would say, nope, this is classic GERD. You just need omeprazole and you need to stop eating garlic and onions.
I'm going to call bullshit on that, because classic GERD is a key sign of a digestive problem or a gut infection or food sensitivities.
Right.
All of which you solved in this program.
Every time the test came back, it was like, check. So I think that the GI stuff is still I'm having some lower GI stuff, but it's much better with the digestive enzyme. And I can really tell when I'm not on the digestive enzyme, or if I didn't take enough or what that might be. But that's definitely been a huge improvement in the last 3 months. I'm also sleeping much better than I was before. Before I was on the Candida kill, I was having improved levels of energy. I'm like pretty tired right now, I think, from the kill. But before that, it was much better. And increased activity. I've been running almost nearly every day.
You're holding out on me. You're not telling me this stuff. Were you trying to surprise me with this? You're running?
Well, I think I was trying to tell you that because I'm a skeptic by nature, every time
you were a skeptic.
Every time it was happening,
how skeptic you were.
Yeah, I mean, well, I can go into that a little bit later.
Well, we could go into that right now.
Yes.
And I'm welcome skeptics. I remember someone like you coming into the program who's a big skeptic. I'm like, bring it. Because for me, I'm all about the medical. I'm all about the science. I'm all about the data. I'm all about the teaching. I'm all about the proof with real people and their results. And you came in extremely skeptical. Let's talk about that. I mean, because you've mentioned that you've been traumatized with your interaction with the whole medical industry and medical providers in the past.
Absolutely. And not just medical providers, but, as I'm sure is fairly common, have had some pretty significant trauma just around trusting relationships in general. And so the skepticism, I think the first thing that hit me when you and I were having our first conversation was like, oh shit, another cult.
Really? Yeah.
Seriously, it kind of felt like that. And there
story around that if something is done in a community and that was actually a lot of mindset work to actually retrain how your brain thinks about this, to actually, I call it sick mindset versus wellness mindset, and they're very different. And I guess to you at that time, at that moment, it sounded like, oh, that's a cult.
Yeah.
Okay.
Yeah.
All right. Fair enough.
That's what it sounded like. I mean, I watch a lot of cult documentaries. I was in a cult when I was younger. So there were a lot of things that were coming up that was like, cult. So I, was with flags, but I think with our first conversation, it was just the way that you talked about really trying to identify the root cause. That was the first time anyone had ever said that to me.
Yeah.
And the medical industry, right, was, oh, here's this medication, or we don't know what's going on, but it's probably this. And so let's think about this, this medication or this testing, or, it'll probably get worse and then we'll figure it out then. And just being overlooked and neglected, right? Every time I went into the doctor's office, it was, well, are you sure you're just not like an anxious person, or,
Prozac or Paxil?
Exactly. Like, maybe this is more of a kind of are you just really stressed out? You're a social worker. You're probably really stressed out. And I would be like, look, I understand that maybe some of the symptoms are a result from stress, but what's stressing me out are my interactions with you more than like.
Yeah, nothing angers me more than not being believed.
Exactly.
Not being acknowledged for the intelligent woman that I am.
Right.
And that happened to me. I was dismissed. When I went into early menopause, I went and saw my colleague, a gynecologist who's a friend of mine. And he said, Maggie, you're just getting older. I'm like, I'm freaking 36 years old. Come on. There's got to be more to this. Right. And only later did I discover by myself that it was autoimmune, right? That the autoimmune attack was causing some of these hormonal changes, causing me to have early menopause. I wasn't just getting older. There was something else at play. So there's a lot of trauma that you felt like you weren't believed, and that caused you to be very skeptical. And so what I'm going to ask you is you said, so what turned it around for you was hearing from me that it's really about root cause. Now let's talk about your experience in the program. So where are you at now with your skepticism and your worries about some cult thing? So where are you at now with that?
The thought crosses my mind sometimes. Just when I think about, like, if I'm being super honest, like Dr. Yu is not only incredibly well-versed and smart in like all the medical pieces, but you're also a businesswoman.
Yes.
And you're a really good businesswoman at that. Mm-hmm. And so there's pieces of both that come in that sometimes I'll go, well, maybe she's just so smart. She's still trying to, like, just get your coin or get your dollar.
What's
or, like,
her angle?
Find a way. Right. Exactly.
What's her angle?
What's her angle? And that is, and like the more that I'm just working through the program and the more I'm actually seeing benefits and seeing my body change and seeing my symptoms change, and also just experiencing the power of validation, both from the testing that none of my doctors had ever done. I had begged them to test my hormones for years.
They don't know how.
I have many hormone issues, and I knew that was a problem. Like, it just, the testing, and then of course your approach to like taking in my skepticism and not being afraid of it, right? And
I was like, bring it.
Yeah, exactly. That kind of stuff really helped me to ease in. So now I'm feeling, more trusting, and I would say that that's been a beautiful kind of separate piece of this outside of my health, has just been entering into a trusting relationship with the medical professional. Has been beautiful and has allowed me to feel more like I can trust myself as well, as a side effect.
100%.
Which means I also feel more myself, and have identified as feeling more Jen in the last several months than I have in about 10 years. It's been
Jen,
a while. Yeah.
You're holding out on me.
I'm one of those where I'm just like, let's wait and see, right? If the trend keeps this way, then I'll feel comfortable sharing the information. But when sharing wins all the time, it makes me feel like it's not as, like, I worry that I'm just trying to make them up. as opposed to, hey, look at, this is really happening. I now have proof. I've got long-term evidence that shows me things are working out.
I was curious, what happened to the tinnitus and the neuropathy? Those are nerve related, so those would take longer time. I tell people that tinnitus and anything that requires, that's nerve injury, takes 6 to 12 months to heal or improve. Where are you at with those two symptoms? You mentioned that the tinnitus was like torture.
It was torture. Tinnitus has been much better. It was always one of those that was ebbing and flowing. I would go through periods where it was 24/7, and then I'd go through periods where it would come up for a whole day and then go away. So right now I would say that when it does happen, it happens for like 10 minutes at a time.
10 minutes.
And yeah, it happens for like, yeah, it's pretty short. And it doesn't happen as often. I would say maybe like a couple times a month at most. So that's been major. The neuropathy, I think, is going to be a little bit more of a journey because my B12 was really, really low.
Yep.
When we looked at it. And I know that I do have a digestive problem, which means until I fix that, I don't know how much I'm absorbing the B12 that I'm taking. Or this is what I've learned from you, right?
Lingual, of course you're absorbing it now.
Yes, yeah. So I'm thinking that'll be something that might be a bit of a later gain after my digestion has improved.
Okay, so are you trusting that you actually have real results that are long lasting and that are continuing to come? Are you at that point where you're ready to trust that these results are real?
Yeah, I feel like I am more and more. I mean, I've been in the program. It's been more than 3 months, Dr. Yu. It's been since January.
5 months.
So it's been almost 6 months.